So welcome friends in this series of frequently used remedies in acute conditions. So this is the last remedy. I made these 5 remedies only because these are the sample remedies. From this type of protocol or this type of pattern of studying or understanding of Materia Medica, you can yourself able to make another remedies like that. So in future, if possible, I will make more helpful remedies in this regard. But I thought that, and I hope you all get about what I discussed in this previous 5 remedies, these 4 remedies about the acute conditions, acunite, belladonna, bryonia, naxamica, and today we are going to discuss about the Pulsatilla. These remedies are very repeatedly day-to-day used remedies, and that's why I am included in our bonus course that will help you to use in your practice. So let's get started on the presentation area of this acute series remedies, that is Pulsatilla. So let's get started. So let's get started about Pulsatilla. That is the face image of Pulsatilla that I frequently use in my practice to begin the case or to entry in the case, mostly in the acute conditions, because all these remedies are acute remedies. So in that sense, we are just focused firstly on the exciting cause. When we deal with the Pulsatilla, so exciting causes of Pulsatilla, we need to understand that. That is the important thing of understanding of acute Materia Medica. So as always says that while treating the acute disease, we need to focus on to the acute exciting cause. So in the Pulsatilla, the food. So food is the very important aspect, because in the Pulsatilla the stomach is get disorder, so that there is a aggravation or all the complaints are begin after fatty foods or the meat or the fish or the milk or ice cream or fatty fruits, spoiled food, pastry, nuts, then sometimes might be fasting. So these are the very important exciting factors for aggravation of Pulsatilla. So when patient will come towards you by after eating this kind of foods, and his or she is telling that she is suffering from that kind of any manifestation, acute condition, at that time you might think about the Pulsatilla. So another important exciting factor is a hot weather or somewhat changing of weather, but mostly it is a hot weather. So that is a very important exciting cause of Pulsatilla. Then getting feet wet. Sometimes women or girls get wet with by doing household work with water. So after that they will suffer from any kind of manifestation of acute type or subacute type. So we can use this Pulsatilla. So cold is another important factor if someone is exposure to the cold, but it is very rare as compared to the other things. And lastly, the fear and grief are the very important psychological factors for Pulsatilla pathology. Some of the patient will landed into the any acute manifestation because of due to fear and grief also. So next important aspect that we need to know about the Pulsatilla, that is the organ affinity and pathology. So it is a very deep acting remedy, but mostly covers the pathology of acute and subacute type, but it is not go in that much of economy. But certain kinds of cases are well treated by Pulsatilla also. So there is confusion in so many homeopaths that this remedy is soric or asoric. So in this sense, I will like to discuss with these important organs that may affect by Pulsatilla pathology, and which type of pathologies Pulsatilla is going to produce in the body. Mucous membrane. Everywhere there is a mucous membrane in the body, there is a Pulsatilla. And this Pulsatilla may produces the catarrhal inflammation. That means everywhere there is a mucus secretions are there whenever there is a mucous membrane is get affected or infected. So that's how we call as there is a mucorrhea is there. So this remedy affects the intestines also. So there is a flatulence, so the passive mucus diarrhea. That means patient will pass mucus from while lose motions. Then varicosity is there because of due to the weakness into the walls of the capillaries, the paralytic weakness in the walls of the capillaries. Then synovial membranes, that's why this remedy is very important into the inflammatory or rheumatic or gouty inflammations. Skin, so on the skin this may produce the innumerable forms of troubles. Eruptions are there, psoriatic eruptions are there, eczematous eruptions are there, urticariatic type of eruptions are there, and in cord mostly the posterior, so it may produce the hyperesthesia and chilliness, neuralgia of this type. But when we discuss on the symptom pattern or the subjectiveness of the pulsatilla that may be produced by patients and complain frequently to us, there are lots of symptoms. So more than 700 of symptoms we are able to know in the pulsatilla when we read the Materia Medica Pura. But here I am just giving you just a introduction or entry of this pulsatilla subjectiveness. So in that the patient is mostly into her or his any trouble. They are fearful, weeping, peevishness, melancholic patients, hysterical type of patients, hypochondriacal type of patients. Then another important symptom, that is the changeability, is we all aware about the changeability of the pulsatilla. That means the one moment patient is very good, but next moment patient is become suffered or ill-humored. So the changeability is there. Sometimes vaginal discharges or some other type of discharges are whitish, sometimes they yellow, sometimes greenish, sometimes brown. So tongue is coated, very changeability is there. So chronic dyspeptic remedy. So when we discuss about the pulsatilla, most of the time patient always said that my stomach is always disturbed or it is disordered, my digestive system is not that much good, I'm always suffering with the dysenteric stools or some mucus stools or indigestion, flatulence, all these things. And most of the time these patients feels suffocated or aggravated in the closed rooms or whenever they go into the bed. So the bed warmth of bed will get aggravated or make uncomfortable to the pulsatilla patients. And lastly, the important thing, whenever the patient is suffering from any kind of pains or any kind of fevers or any troubles, at that time patient is feeling chilliness of inside. He or she feels that she is just get chilling inside. So that type of very typical subjectiveness of pulsatilla. And when we see here is the physical general and mental general aspect of the pulsatilla, that is patient is appetite is they just increased, but sometimes I observed there is decrease in the appetite, but you can consider both the things, either increase and decrease. But taste is diminished because tongue is too much coated white or brown, and mostly it is in the morning, so that's why loss of taste is there. So the patient is reluctant to eat or she have aversion to certain kinds of foods also. The thirst is drastically decreased. The patient doesn't have a desire to drink water at all, but in a disease condition, not in normal pattern. I always says that don't focus on to the normal genetic traits or habits of the patients. In sleep pattern, so again there is a patient in early part of night there is difficulty sleeping, but late next part of the night patient sleeps well. So but so many books gives that there is a loss of sleep, some might be the good sleep. Menses are changed from very prolonged to the scanty menses, and in mind aspect or mental general patient is becomes tearful, peevishness, irritability, crankiness, all that is the face image of pulsatilla. If you are able to use that face image to enter into the pulsatilla case or pulsatilla type of pathology, it will help you. So use in your day-to-day practice, because this remedy is very important in your acute and subacute type of pathologies. So let's get started on the details of this Pulsatilla also, but here I am not able to show you details, but you need to follow, you need to confirm the further symptoms of subjective type, which type of organ is get affected. There are so many: ear, nose, sexual organs, urinary systems. So many organs are again influence of this Pulsatilla, but here because of due to some technical difficulties I am not able to discuss all the things here. So keep watching videos for future motivation. So we'll discuss over the next about details of Pulsatilla.